Last but not least, we have the hypoglossal nerve. The hypoglossal nerve is entirely somatic motor to all of the intrinsic and extrinsic muscles of the tongue, with one exception. The palatoglossus, as the name implies, was from the palate down to the tongue. That is not innervated by the hypoglossal nerve. That is innervated by the vagus nerve. Okay? The hypoglossal nerve, as you can see up here, let me click on there, it actually originates via several little rootlets from the medulla, and it leaves the cranium through its own dedicated canal, the hypoglossal canal. There's the hypoglossal canal, which is located in the posterior cranial fossa. After the hypoglossal nerve exits through the cranial cavity, let me see if I can show it down here, it runs inferiorly, medial to the angle of the mandible, and then curves anteriorly to enter the tongue. In humans, there is additionally a meningeal branch that actually returns back to the cranium, and, well, it's called meningeal branch, so what it does, it actually innervates part of the dura mater on the floor and on the posterior wall of the cranial fossa. So it's sensory innervation to that. However, that will be a contradiction to the statement that the hypoglossal nerve is entirely motor. No, it's not really, because the nerve fibers, they actually come from spinal ganglia from spinal nerve C2, not from the hypoglossal nerve itself. They just hitch a ride. It's an old story, we know that, because we know also that coming off the hypoglossal nerve when we go down here is actually the ansa cervicalis, the nerve loop of the neck. It's not indicated here if you're wondering why you're not seeing it, but you would actually have, it's called the ansa cervicalis, means the nerve loop of the neck, that is innervation for your infrahyoid muscles, for instance. If you want to test the hypoglossal nerve, that's pretty simple. This is the one time that you're actually allowed to stick your tongue out at someone. So you ask the patient to stick the tongue out straight, or try and stick it out straight, and if it deviates to the right or left, well, we know that the genioglossus muscles are responsible for the protrusion of the tongue. So if you have a lesion to the right or left hypoglossal nerve, it will deviate, and it will deviate towards the side of the lesion, right? So in normal protrusion, the tongue will stick out straight, because both pairs of muscles will contract at the same time. However, if you have cranial nerve 12 damage on one side, like the right side, the tongue muscles there are going to atrophy. So when you stick out your tongue, it's going to deviate towards the paralyzed, so the right side.